Complacency may be setting in among seniors as Singapore continues to battle the COVID-19 pandemic. A study shows that they're less afraid of the coronavirus and not taking as many precautions like washing hands and safe distancing compared with before. More than 760 people aged 60 and above were polled for the National University Health System report. Data was collected before, during and after the circuit breaker period up until January this year. For more, we're joined by the cognitive neuroscientist who led that study, Dr. Yu Junhong. Welcome, Dr. Yu. First, I just want to get your thoughts about what the team found out about the behaviours of seniors with regard to COVID-19.
Well, I mean, as you have mentioned, we noticed that there are signs of complacency. They are no longer fearing getting infected. They are no longer perceiving the risks of getting infected. So a lot of things have changed. They are not doing a lot of this like protective behavior. So it's indeed the case that we see that complacency has set in.
What's motivating the complacency?
I guess there are some signs that people are habituating to the situation. You're getting too comfortable. And perhaps this might be in part due to the fact that I think the situation in Singapore is relatively comfortable.
Dr. Yu, it would be speculative to ask you why the 280,000 elderly people who haven't yet gotten vaccinated, according to Prime Minister Lee Hsien Loong's figures, that it has to do with a lack of fear. But could potentially a lack of fear be behind not wanting to be vaccinated or not finding that it would be important?
I guess you can say that. I mean, the lack of fear. They don't see it as a necessity since things are going around pretty okay for them. And I guess for a certain group of people, they might have certain misconceptions about the vaccine. And that's preventing them from getting a vaccine.
All right, let's look at a different aspect of the study because it found that, depression, anxiety, loneliness, all those emotions went up during the circuit breaker, but didn't come back down even after we gradually reopened. Can you explain a bit about that trend?
So, depression, anxiety, loneliness, it went up. They went up quite expectedly during the circuit breaker, due to the social distancing restrictions, and back then there was an atmosphere of fear and uncertainty. And these measures of psychological well-being, it did improve a little bit in phase 2 and phase 3, but just that it hasn't quite returned back to the pre-COVID-19 baseline levels. And so you might ask, why is the recovery so slow? We speculate this is because the circuit breaker might have resulted in long-lasting disruptions to our participants' social network and resources. For instance, certain groups of people might have lost contact with friends. Relationships tend to drift apart without face-to-face interactions. And then, some people might have difficulty restarting social engagements. So this, coupled with the need to adhere to social distancing measures and the difficulty for some group of people to shift their social lives online, meant that they are not getting adequate social support to facilitate the recovery.
Dr. Yu, we're already into the second year of this pandemic. If it drags on, could there be long-lasting effects down the road?
Well, as I mentioned earlier, I believe it will only be a matter of time before because the well-being indices are back to baseline levels. In fact, they are improving slowly. They are on a slow recovering trajectory, but it's slow. It's difficult to predict how long such distress will persist. But there are indeed signs that people are gradually habituating to the situation. That's good. But however, personally, I think that the COVID-19 situation remains relatively unpredictable. So it's very difficult to predict how long this will last. But nevertheless, I believe, vaccinations, we are rolling out the vaccinations. So I believe this will probably give seniors a peace of mind, and thus might actually alleviate some of their distress.
Yeah, I guess the value in a study like this is that it gives us clues about, how to support the seniors going forward. Could even shape that support and policies that they need most. Do you think?
Well, yeah, I mean, we found that, in terms of social support, this is something that we can work a bit more, yeah, but then again, I guess different people, will have different needs and their circumstances might be very different. Some people might be doing relatively okay. Some people might have some trouble adjusting to restrictions. For instance, like some find that the no dine-in rule a little overbearing and inconvenient, and some people have difficulty shifting their social lives online. So, I mean, there are a lot of these small problems, which I think I don't think these issues are difficult to resolve. In any case, I think regardless of the different needs and circumstances, the most basic thing that we or anyone can do for them, is to just basically reach out to them in an empathetic manner, and just lend them your ears and hear them out. Give them your undivided attention.
All right, thank you so much. We've been speaking there with Dr. Yu Junhong, Principal Investigator from the NUHS Mind Science Centre.